Entire video on another patient and realized I was blocking the camera. So here's another way to mobilize the elbow in end range extension. I'm gonna have you just slide this leg over a little bit, Matt. Perfect. Okay, so what you're going to do is grab your patient's arm. You can do this lying down. I prefer it seated. I feel like I can generate more force. You're gonna want your patient in a fully supinated position. I am pinning my patient's arm between my arm and my body. On the medial side, we're going to do a medial and lateral glide of the elbow, which I recognize that the humeroulnar joint does not move medially and laterally. However, this is a way to work on end range extension. So from here, I'm going to have one hand on the medial border of my patient's ulna. My right hand is going to go on the lateral side of my patient's distal humerus. Elbows are going to be flared out, so I have a good line of drive. And then from here, it's just an equal and opposite force. That feels okay?
Yeah.
I usually will do a little bit of like oscillations or some bouncing at the end of that motion. I'm not trying to like jam it into this, lateral glide. It's just working on that end range extension. Then after I do a few rounds there, I'll just slide my body over the opposite side and then switch my hand. So now my left hand is on the distal medial part of my patient's humerus, and then my right hand is going to go on the proximal lateral radius. And again, you want your patient fully supinated. Perfect, thank you. Then from here, same thing. Watch how far out my elbows are so I have a good line of drive. And that is another way to work on end range elbow extension. There are ways to do this in elbow flexion as well, which I will show you. Thank you, Matt.